Welcome everyone to Amize Health. I'm Dr. Thorpe Amize. I'm so happy to have you join me this evening. And I I basically wanted to let everyone know that today's session is primarily about screening tests, which is what I've been talking about in the past 3 weeks. And so typically with screening tests, they're done at an annual physical. Not that they can't be done at any other time, but that's usually when they're done. Just for more information, if you have the time, if you haven't seen the videos, go back and watch them. But for now, I'm just going to do a quick summary of what the things that I covered in the past were. So we've covered lab testing, and the ones that are typically done at a physical are like BMP, which tells us your blood sugar levels. It's going to give us some idea about how your electrolytes are doing. Tells us a little bit of how your kidney function is, and then we tend to do cholesterol tests. So we check your cholesterol levels. Usually, when we check cholesterol levels, those are fasting studies. So if you're going in for a physical with a plan to do labs on that same day, we want to make sure we go ahead and have you fast. And you want to do the fast for at least 8 hours prior to when you're going to have the labs drawn. um, that just gives us more accurate information. So if you've eaten something, typically we can tell when we see those labs because some of those numbers are just thrown all out of whack. And then we also, like I mentioned, so blood sugar, electrolytes, we're checking your cholesterol levels. One of the things that we tend to check is your A1C, which is the test that we use to check for diabetes. And then we will offer STD testing as part of that physical. And I know some people have said that they haven't been offered that, but if you don't get offered STD testing by your physician, one of the things that you can do is just go ahead and ask them to do it. And the testing that we typically recommend is gonorrhea, chlamydia, HIV, and then Hep C at least once. So Hep C is not something that we test every single year, but you need to have it done at least once. And then for any kind of high risk sexual behavior, and I discuss what those are, and if you want me to go through that, just let me know in the comments. But for any high risk sexual behavior, we do testing for syphilis and hepatitis B also. And then I did want to mention that HSV1, which is herpes simplex virus 1, and HSV2, they can cause genital herpes, but we tend to not screen for those because part of that is just that it's so prevalent that it's just not something that we screen for. And then moving into the testing that we do for for cancers, we do recommend PAP testing. So for anyone with a cervix, we begin PAP testing at 21 years old, and those recommendations are based on the American College of Obstetrics and Gynecology and USPSTF. The recommendation from the American Cancer Society is actually at an older age, which is 25. And then for breast cancer screening, we do mammograms. We recommend that you start that at 45 years old. If you have a strong family history for breast cancer, then you likely will be starting earlier. And it does depend on when your family member was initially diagnosed and how close they are. And when I say how close they are, I mean, is this a primary relative like a parent or a sibling, or is this like a secondary relative like a cousin? And we also recommend at 45 starting colorectal cancer screening. So we do that with stool testing, and the stool is looking for microscopic blood in the stool or a colonoscopy. And again, if you have family members that have had colon cancer, then the age at which you start testing is actually partially based on that. So that's a conversation that you need to have with your primary care doctor. So screening intervals are tend to be based on your personal history, meaning do you have any pre-existing medical conditions that put you at higher risk for having one of these illnesses. And then it's also dependent on your family history. So, this is why it really being transparent with your primary care doctor is important. So, having run through what those key points were that I discussed in the past 3 weeks, I'm going to go ahead and start opening it up for questions if any one of you have any questions that I can answer. And in order to let me know that you have a question, just go ahead and type that into the chat for me. So, one of the things that I wanted to also mention while you guys are coming up with those questions are is that if you have a topic that you want me to talk about, whether it be in the videos or the Q&A, definitely just go ahead and let me know by putting that in the chat also. Okay, so one of the questions that just came up is what is the age for breast cancer screening and how often do you have to be screened? And that's actually a great question. So, for breast cancer screening, we do tend to recommend that you start. Let me back up. According to the American College or the American Cancer Society, sorry, the recommendation is that you start at 45. So you want to start off with a mammogram, and we're recommending that you get an annual mammogram. The reason for that really is to make sure that we're keeping track of any changes that are happening in the breast. So any between the ages of 45 and 54 to 55, it's an annual. After that, then you can go to biannual get if you've had normal mammograms in the past. A lot of women, especially Black women, will have what we typically see on mammograms called dense breast tissue. So, if you happen to be blessed in that area and you get a mammogram reading that says, oh, you have dense breasts. That's actually quite common. It's not something to be alarmed about. It's just that the interval for which you will have a repeat mammogram may be different. So, for instance, it may be if something was seen that they felt like they didn't get a good enough image, they might need another form of imaging modality in order to get a better look. Sometimes the read says, oh, there's dense breast tissue, but they were able to actually see everything that they needed to see. And in that case, they will just let you know what interval to follow up at. So so again, for anyone who does not have a family history of breast cancer, and when I say family history, I'm talking about primary relatives or not having multiple relatives with an illness. So if you don't have a family history, then the start for breast cancer screening is 45 years old. If you do have a family history of breast cancer, and unfortunately it's something that's rampant in the Black community, um, or more so than in other groups. If you have a family history of this, then typically what happens is the age at which your parent or sibling or whomever it is was diagnosed is used to determine how soon you need to be assessed. So if that person was diagnosed at 45, then you likely will be starting mammograms at 40. So often it's 5 years earlier. If it is that there's a family history that's significant, meaning you have mom and sister and grand aunt and grandma, and everyone has this history of having breast cancer, and you're concerned. So even if you're in your 20s, I would say this is something that you need to bring up to your doctor, because when it runs in the family in that way, the first thing that we begin to become concerned about is whether or not there's a genetic component that's causing the breast cancer in the family. And so what happens is we do a risk assessment to determine if in fact there might be a genetic component, and if there is, one of the things that we do is recommend that you get genetic counseling. And the reason for that is because then the next step is testing for BRCA mutation, or that's the most common form of mutation where it runs in families. So I hope that was a long-winded way to answer your question and probably gave more information than you wanted, but I hope that answered the question for you. So any other questions, just go ahead and type them into the chat. So I did have, okay, I just saw another question pop up. Um, is it possible for a screening test to show an incorrect result leading to a misdiagnosis? Yes, and yes. So testing is just that, it's testing. We're human beings, and as human beings, sometimes errors happen. And sometimes it's the error is within the test itself. So oftentimes when we get a test result, if it's something that is either far-fetched or is a slight, even a slight elevation. For instance, I'll use the example of doing liver function tests. So sometimes we will test as part of the annual physical labs. We'll do a liver function test as part of that BMP study that I mentioned earlier. And if those tests are elevated, we will then go ahead and say, well, you had an elevated liver function panel or liver test panel. So we will repeat this test. And depending on the elevation, that determines how soon the test will be repeated. And so we repeat the test to ensure that, in fact, it is elevated. If it was egregiously elevated, then obviously we'll be repeating it sooner than later. But if it's only a slight elevation, we might wait because sometimes you can have transient increases in lab values. And so sometimes we'll wait for maybe a month, 6 weeks before repeating. But if it's grossly elevated, then we'll go ahead and give it a few days or even a week and then repeat just to ensure that that's correct. So oftentimes we don't make a diagnosis. So when you asked, the question was whether or not it would lead to an incorrect diagnosis or a misdiagnosis. Oftentimes the diagnosis is not made based on one factor or on one test result. And so the repeat is actually important for establishing that diagnosis. So I hope that was sufficient to answer your question. Any additional questions, go ahead and type them into um, the chat. As I mentioned before, the primary thing that we're talking about this session is about screening tests. And screening tests are typically done during your physical exam, but they can be done at other times also. Any additional questions? So I was happy to answer your question, no problem. Um, One of the things that I did want to mention is, especially we're pretty much at the end of Black History Month now, and sometimes this is one of the common misconceptions about skin cancers. And people say, "Oh, I'm Black. I don't need to wear sunscreen," and they don't really think that skin cancer is something that can affect Black people. And I will say that that is incorrect thinking. So for skin cancers, if you have an abnormality on the skin, you do need to get it examined. So the things that we check for are changes. If you have, like, let's say a mole, and many of us do, and they're benign, they're meaning that they're not harmful, they're not cancerous. But if you notice that you've had a mole that looked the same way for, I don't know, 10 years, even if it's, and you notice, oh my gosh, it's darker than it used to be. So changes in color is one, or it's the shape is not quite the same as what it used to be. It's asymmetric. The borders are now blurred, meaning it's not a sharply demarcated line anymore. And, so all of these changes are happening to what used to look like a normal mole. That needs to be evaluated because that could potentially be a cancerous lesion. And the only way to know whether or not it is to get it examined. One of the common ones that tends to pop up is on beneath the nails, the fingernails or the toenails. You have discoloration and don't really realize that something is growing there. Just get it examined just to be sure. If you bumped your toe, come on now. If you bumped your toe and that's what caused it to be black, that's not what it is. But I mean, if something has been growing over time and has been producing any changes, that's what you would need to go ahead and get checked out. So those are the kinds of things I'm talking about. Sunscreen is important to help us, help to protect us from the sun's rays. And so, although our beautiful melanin is somewhat protective, it is not all the way protective. And so we really do need to be mindful of that and take care of our skins. Okay. And so another question just popped up: who do you go to for a skin cancer screening? So that typically is done if you are a fair skinned individual, or if you are someone who has, again, family history of skin cancer, you would need to be seen by dermatology. However, the one stop shop for everything really first is your primary care doctor. At your physical, and I know that a lot of primary care doctors don't do this as much anymore, but at your physical, you really should be undressed, because one of the things that is being assessed while the physical is happening is your skin. And so typically when I see a patient in the office and I take a look at their skin, if I let's say that you've been my patient for the past 3 years, chances are if I see something new on your skin, I'm going to say, hey, what happened there? And sometimes if it's on the back, it's something that the person never didn't even notice is there. And so that's one of the reasons why it's important to actually have a thorough physical exam done. However, if it's something that you are absolutely concerned about, dermatology is the place that you typically get evaluated for that. Okay, if you have a lot, and some families do, some people have a lot of moles, and so when they have a lot of moles, it's hard to keep track of which ones are changing and which ones are not. Um, then you need to be followed by dermatology. Okay. Any additional questions, whether it be about what I just mentioned about skin cancer or any of the other screening tests? Okay. So, um, I was fortunate enough to have, okay, I'll go into that after this next question. So, this next question says, I had a doctor push for treatment after a screening diagnosis, but I was not comfortable moving forward. Should I seek a second opinion? So, I will give a twofold answer to this. One, should you seek a second opinion? You are always free to seek a second opinion if that's what you want. If you feel like either you are uncomfortable with the physician that you've seen, or you are uncomfortable with the decision making of the physician you've seen and you want a second opinion, absolutely get it. Uh, the other part of that is, I don't the process of determining treatment shouldn't be that someone is either pushing or forcing you to do anything. It should be a shared decision. Meaning that if something, like, let's say we do one of these screening tests and something comes back abnormal, then my response as your physician should be, this was abnormal. These are your options, and I give you options. These are your options. How would you like to proceed? So it should not be, this is what you have to do, because even if, let's say that we're dealing with something where there's only one or two treatment options. Even if there's only one option available, you are still within your right to say, no, I do not want that, as long as you understand what not taking treatment means. So, um, if you are given the treatment, the side effects, potential side effects, complications, what can happen if you do or don't take the treatment, then you can refuse treatment. And that doesn't necessarily require you to have a second opinion. However, if you're just not comfortable with the doctor that's seeing you, like I mentioned before, then yes, get a second opinion. But no one really should be coercing or forcing or pushing for you to get a specific type of treatment. Sometimes, and I'll say some of us get so passionate about trying to fix something that it can, borderline pushing or coercing. Um, and sometimes that's what it is, because they know that, okay, this thing can be fixed if we would only do this. And so sometimes some doctors do get a little pushy, and, I think as long as you are comfortable with that doctor, have that conversation with them. Keep the lines of communication open. Say that you are not comfortable, or you don't know enough. You don't have enough information to make a decision yet, so that they can provide you with that. If they are unwilling to provide you with the information that you need in order to make an informed decision, then absolutely see someone else for a second opinion. I hope I was able to answer that question for you. Any additional questions? And for those of you who may just be joining us, please type your questions into the chat. I'll be happy to answer. We are talking about screening tests, lab tests, STD tests, and cancer screens. So please type any questions that you have into the chat, and I'll be happy to answer for you. And I was mentioning before that I was fortunate enough to have some someone that wasn't able to hop on ask a question. So let me get that for you. So actually, I answered this before. So it was about the fact that I spoke about different types of cancers in the previous recordings, and they were curious about if other cancer types required regular testing or screening. So there's so many different types of cancers, and they don't all have screening tests, unfortunately. So the primary ones that do have screening tests that have been shown to be beneficial um, are the ones that I brought up, which is cervical cancer screening with the pap test, mammograms for breast cancer screening, the stool test or colonoscopy for colorectal, the low dose CT for lung cancer, and then for prostate cancer, we do use a PSA, which is just a lab test, and then um, for men that hit 50, they're aware of the digital rectal exam. So we do all of those things, and then I just spoke before about having just your skin examined, and kind of monitoring any changes in any moles that may be on your body for changes, and that's kind of how we monitor skin. But most other cancers, and there, like I said, there are thousands, there are so many different types of cancers, unfortunately we do not have screening tests for, which again, screening tests are used to evaluate you before, um, when you don't have any symptoms, in order to determine if anything is there that need to be monitored or addressed. Once you begin to have symptoms, it's no longer screening, it's diagnostic. And for, in a lot of cases, the diagnostic test is not always the exact same as a screening test. So for instance, with breast cancer screening, um, when you do a mammogram, there is a screening mammogram and then there's a diagnostic mammogram, which is, the process is the same, but what they're looking for on the mammogram and the exposure is a little bit different. So once you begin to have any type of symptoms, diagnostic testing is recommended, and that's what's needed. Okay. Any additional questions? Any additional questions? Type them into the chat. I'm happy to answer them for you guys. And definitely provide any feedback if you feel like your question wasn't fully answered. I'm more than happy to go over it a little bit further. Okay. Let me go ahead and pull up. So one of the other questions was, someone has a family history of cervical cancer. Uh, so the parent had cervical cancer, and they're male. Does this mean there's a possibility of of female children having cervical cancer? So cervical cancer can run in families. So you can end up, so like if mom and grandma had cervical cancer, it's a possibility that child could have cervical cancer. And part of the reason for that is that studies have shown that it could be some the susceptibility of HPV, which HPV virus can cause cervical cancer, especially the high risk strains. So if you are one of the people that has decreased ability to clear the HPV virus, then it increases the risk of cervical cancer. And so in that sense, yes, it can. If that answers that question, it can potentially run in families. We do recommend starting, like I mentioned before, PAP screening at 21 years old for anyone with a cervix, and it is for that reason. So at 21, we do the pap smear, which means we're testing the cells of the cervix to determine if there's any changes there. And those changes, we typically catch them early, because there are stages before it becomes cancer. So we want to catch any kind of cellular changes early. And for from for 21-year-olds, all the way until 29. So when you're in your 20s, we're only doing the cellular testing. We do not do HPV testing when you are that young. And part of the reason is because, um, at that age or in that age group, most people will clear the HPV. And so if you're not clearing it, it's going to cause cellular changes, or the cellular changes will show up on the pap test. So after 29, so once you become 30, You then start to have to get, you can do HPV and the cytology is what we call it when we check the cells. We could do HPV and cytology. So we can check for both. So if you are having cytology done alone, which you can continue to do into your 30s and 40s and 50s, you can continue to do cytology alone or checking the cells alone. Um, but if you do that, then we recommend you do that test every 3 years. If you do co-testing, which is what it's called when you do both cytology and HPV, if you do co-testing, which most offices do, then we recommend that you do it every 5 years. Now, that is one of these things that that's recommended by the American College of Obstetrics and Gynecology. And that is the source of a lot of contention for a lot of women because some people are like, well, what happened? I was getting this done every single year. And now you talk about 5 years. I'm not going to wait 5 years. You technically don't have to. That is the recommendation. However, many gynecologists will go ahead and have you still come in annually for testings. But what I did was I just went over what the recommendations are. It doesn't ever, everyone is an individual and we take everything on a case by case basis. If you are someone that says, well, no, I want to do my PAP every year, you're free to do that. I just also want to add in that sometimes when you choose to do testing at an interval that is outside of the recommendation, that sometimes your insurance will not cover it. And as much as that sucks, but that is the case that sometimes insurance will not cover it. So that's the recommended time period for getting the testing. But right now, as far as I'm aware, many of the insurances still will cover if you do it annually. Okay. Any additional questions? Go ahead and type them into the chat. I'm happy to answer them for you. And for those of you that recently joined us, we are talking about screening tests. And the screening tests include lab tests, STD testing, and cancer screens. So if you have any questions about any of those things, feel free to go ahead and place them in the chat and I'll answer for you. And I will also say if there are any topics that any of you want me to discuss in the future, also feel free to put those in the chat. Also, I want to make sure that the things that I'm putting out there are things that you all want to hear about or want to learn about. Okay. Any additional questions? And please, for some of you that may be shy, don't be, go ahead. No question is too silly. And I am happy to answer anything for you. The purpose of this platform is really to help you all get informed, to take control of your health. And it's not to say that you're not in control already, but more information never hurt anyone. So I am happy to answer any of the questions that you all have. Okay. So another question that I'm gonna go ahead that I was sent is, do I really need screening if I play it safe? And so this is related to STD screening. Do I really need screening if I play it safe? I know a lot of people that are active and they don't do screening and they're just fine. And that's probably true. Um, However, number one, do you really need screening if you play it safe? What does playing it safe even mean? So playing it safe can be, have you had the same partner, same long-term partner, like, not to exclude anyone, but if you are married or have been in a long-term relationship, and you've been with that partner, you both got tested before you started, there's no infidelity, all, then it's your decision. If you don't want to do the screening, then you don't have to. Um, but I would recommend, if you are not in a long-term relationship, or you don't have, if you have multiple partners, or if you have recently changed partners, um, you absolutely should be screened. I recommend the screening once yearly. People do, quote unquote, play it safe, or do seem fine. But I will venture to say, for these people that this person is asking about, number one, we don't always share our personal health information with others. So, what someone is telling you may not always be the case, because that's their personal health. They may just not be telling you what symptoms they may or may not be having. So, there's that. And then the fact that many STDs like gonorrhea, chlamydia, even hepatitis B or C, a lot of STDs will not have symptoms for a long time. So the person may not show any symptoms, so they think they're fine. But the reason why they think they're fine is because they're not actively having any symptoms until one day when they do, or maybe they never have symptoms. So, speaking to women again right now, if you if you if a female contracts, let's say, chlamydia, and don't have any symptoms, they can have that infection for a long period of time, which will end up impacting their fertility, which basically means over time there is damage that happens from that infection long term that will impact their ability to have children. So, getting checked is for your safety. It's not to make anyone feel bad. It's not that anyone is going to think you're unclean, because this is something that I've heard people say before. It's not, this is just for your safety. Because why? If you get tested and find out that you have one of these, gonorrhea or chlamydia, it's treatable, or trichomonas. It's treatable. We treat, you move on. Um, Unfortunately, not everything is curable. So I should put it like this: gonorrhea, chlamydia, curable; HIV, treatable. So, even though we can treat things that you get, everything is not curable. And so, really, for your protection, that's why it makes sense for you to go ahead and get tested. If you are, and I will say this again, if you are in a relationship, and you are not 100% trusting of your partner, meaning that you are not sure if there is infidelity, you need to get tested. Because, if you are uncertain, it's better to just be safe. So go ahead and get tested. And if you are someone that is in a domestic violence situation, if you are not feeling safe in your relationship, this is another reason to get tested. Okay. So, any additional questions for me, go ahead and type them into the chat. I am happy to answer. Any additional questions? So, as I wait for you guys who are shy, I'm gonna go ahead. I think I have one last question that was sent over to me, and I will ask. So, do do blood disorders require regular screening, such as like hemophilia or sickle cell? So they don't. I guess in a way, I'm curious to know more about that question. So Usually, for children that are born in the US, at birth, screening is done for hemophilia and sickle cell. It's basically a panel of testing that's done when kids are born. Um, so, oftentimes, that's when it is found out whether or not um, a child is either a carrier or has a trait versus having a disease. But even going further back than that, in pregnancy, the mom typically is tested um, for various things, and one of them is basically like blood disorders like sickle cell. So if mom is tested and mom carries the trait, or mom is already aware that they have sickle cell, then that automatically will create a higher alert to the child potentially having sickle cell. So what will happen is if mom is a carrier, then dad also need to be tested to see if it's a possibility. So then at birth, the testing is done anyway, even if you didn't know, because some women didn't get prenatal care. So the testing is done and it's found out then. However, if let's say you moved from another country, or it's not something that's commonly done where you're from, or you just want to know, if you're concerned, then it's just something that you can, bring up with your primary care doctor to say, hey, I'm concerned about this, or I was wondering, am I a carrier? I just want to know. And they'll go ahead and order the testing, but it is not, as an adult, it is not a required or a regular screening test. And I hope that answers that question for you. Any other questions? So, again, I'm happy to answer any questions you guys have on screening tests, and you can let me know if there are any topics that you want me to either talk about or do a Q&A about in the future. Just drop it in the chat so I am aware. Um, so I think I have gone through quite a bit here this evening. I'm just trying to make sure that I cover anything else that you all might want to hear about. The only other thing that I guess I would mention is that I don't think I talked about before, for prostate cancer, for men, or for anyone that is African American or of African descent. We recommend that you start having a conversation with your primary care doctor about screening at 45. Um, and then once you, because most men, we don't start checking the PSA until 50, but in African American men, we want to go ahead and start doing that at 45. Okay. Any additional questions? And then I did want to go back. I know I'm going kind of back and forth here, and I'm just waiting for you guys, any additional questions to pop up. But for anyone who is a female that had a hysterectomy, which includes removal of the cervix. So if you are an older female, maybe in your 50s, hysterectomies that were done in, many years ago, 20 years ago, hysterectomies that were done at that time, sometimes they actually left the cervix in place. So they only remove the uterus and the cervix is still there. So if you still have your cervix, you still have to do cervical cancer screening. But for more recent hysterectomies, the cervix tends to be removed with the hysterectomy. If you're not sure whether or not which one you had, you can ask your doctor. Typically, on your documentation, if you had everything removed, it'll say total hysterectomy. Sometimes the documentation only says hysterectomy, which doesn't really help because it doesn't tell us whether or not the cervix was removed. But like I said, for more recent surgeries, the cervix was removed. It's usually the ones that are much older that sometimes still have the cervix in place. Okay. And then after age 65, with enough adequate, so if you've had multiple negative PAPs, once you get to 65, woohoo, you don't have to do it anymore. But that's really if they were normal. If you've had abnormalities, then you likely have a plan with your GYN about getting additional testing and kind of what the testing interval is. Okay. Any additional questions for me? Go ahead and type them into the chat. Okay. So just to continue here to see if there's any additional information that I can give you guys on these. Um, if you just thinking of the things that commonly happen when patients come into the office, sometimes people come in and they are like, "I heard so and so." I don't know. Men often will say, "Oh, everybody's talking about low T. I want my testosterone checked." So testosterone testing is not it's not a screening test. Typically, there has to be a reason for us to check your testosterone, and so that's not something that is recommended per se. And maybe at some point I'll do kind of a talk on that, but yeah, it's not a recommended screening test. And many of us will go into our doctor's office and we have an idea of what we want to have tested. And while that's okay, but I if your doctor tells you that you do not need to have a test done, kindly just don't get upset. Just ask why that is. Because sometimes it just some of the things that people come in and ask to have tested, um, it will not be useful. It will not change management. Um, and then if there is a slight point one over and now it looks abnormal, then you're kind of chasing something that isn't really useful. And so for some tests, they're just not recommended. So if you go to your doctor and you're like, I want to be tested for X, first off, there should be a reason why you want to be tested. Um, and then if obviously if there's an adequate reason, likely you'll get tested for it. But not just like, oh, test me for everything. That's another one that people often say, well, test me for everything. What does everything mean? So everything to me means everything that is part of the recommendation. So if it is outside of the recommendation, I'm not going to do that test unless there is a reason to. And I'm going to use the herpes simplex virus as an example. A lot of people will say, well, they're doing a STD testing and they want to get tested for herpes. Um, and yeah, we can do testing, but it really isn't very useful um, for just for the sake of testing. I guess that's the best way to put it. Just for the sake of testing. And part of the reason why is what we look for when we do blood tests for herpes is the antibodies to the herpes virus. So one antibody tells us, did you have a recent infection? The other antibody tells us, have you ever been exposed to herpes? Meaning, did you ever in your life get exposed to herpes? Where at one point you may have had it, did you got exposed to it? And that's what the antibodies tell us. It does not tell us that you have active herpes right now. It does not. And so that's part of why screening is just not recommended. Um, However, if you are someone that noticed, whether it be oral sore or ulcer or blister, or a genital sore, ulcer, blister, and you're like concerned, oh my God, I was just with this person. I wasn't aware they may have had X or Y, and I just need to be tested, and I'm not sure what this is. I've never had this before. So, in that situation, remember we talked about screening tests versus diagnostic tests. In that situation, now we're talking about a diagnostic test. And what will happen is that is not a blood test, it is a swab of the area. And we send the swab off to be cultured, or we test that swab, the discharge from that swab, to determine if the virus is present. And if the virus is present, then it says, yes, you have herpes, and this is an active herpes infection. Um, so that's how that works. But come when you say, oh, I just want to be tested and I just want the blood test is only telling us, have you had a recent infection or exposure to herpes, or have you had one in the past? Now, it does not tell us when in the past. It does not give that kind of information. And so people who are demanding that they get tested oftentimes will get a positive result, and then they're scared and they're upset and they want to know, when did it happen, and we cannot tell that. Okay? So that is a big part of the reason why we do not screen for herpes, because it it does not tell us if you're having an active infection. Only an active outbreak can do that. And many people, like I mentioned before, have herpes. Most people will never have an outbreak or never show a sign. Some people do. If you have a low immune system for one reason or another, maybe a pre-existing condition, if your immune system is low, the likelihood of having a herpes outbreak, if you have herpes, is actually higher. Okay. So we are, coming down to the last few minutes. So, any last questions from anyone out there? Go ahead and type it into the chat, and I would be happy to answer for you. I just wanted to check my phone here to see if anyone had sent me any questions. So, any additional questions from anyone? Okay. So, I know we went through a lot of information today. I hope it was useful. Uh, and so I hope I hope all the information that I went through was useful. Um, like I mentioned before, I did get, in terms of kind of all the screening for the cancer screens, there are different bodies that make different recommendations. So if you go, one body will say, oh, start at 50, and another will say, start at 45. Everyone, so don't get upset if your doctor says, oh, no, we're not starting then, we're starting at this time. And then you're like, well, Dr. Thorpe said, yes, Dr. Thorpe did say. Um, I, you know, I tend to go with the body that tells me to do it earlier. And the reason for that is because I don't want to miss anything in anyone. So I will go with the body that tells me the recommendation is to do it earlier. If they, like, for instance, with pap testing, I go with the ones that say do it at 21, because the American Cancer Society recommends starting at 25. So I go with the ones that say 21. So I will always go with the ones that say earlier. So if your doctor wants to wait and do it on the later recommendations, uh, that's okay also. However, if you want it to be done earlier based on the recommendations that I mentioned here today, absolutely just say, well, I was listening to Dr. So and so, whether you want to say my name or not, it's fine. But, and she mentioned that I can actually get this done at this age. So do that. But please don't say it if I didn't say it. Okay. It's been a pleasure having you guys on for all those who joined tonight. And